Our next presenter is Dr. Julie Levy. Dr. Levy is the director of Maddie's Shelter Medicine Program at the University of Florida. Dr. Levy's research and clinical interests center on feline infectious diseases, neonatal kitten health, humane alternatives for cat population control, and immunocontraceptive vaccines for cats. She's the founder of Operation Catnip, with 2 university-based feral cat spay-neuter programs, and has been published in more than 100 journals and textbooks. She's quite a national authority, and we're delighted to have her here today.
Thank you. I've been thrilled with the presentations that have come before me, and they're just so inspiring, and I've learned a lot of tips to bring back to my own community. And I think that what we've heard expressed so far is how critically important good management is. That's where everything starts in the sheltering world, and I wish we could clone some of these good managers because I know how hard they are to find. We've also heard how proper housing and innovative solutions to the shelter facility are so important, and the critical importance of recognizing and meeting the behavioral and enrichment needs of our pets to keep them healthy while they're waiting for their good home are. And so I'd like to spend my time focusing on how a shelter medicine component of your sheltering program can also add to your life-saving goals. So in my former life, I was a specialist in internal medicine. I came to work in a university where I saw individual animals who were owned by people who would do anything to save them. Very often, the resources we needed were unlimited. These clients frequently would not put a financial cap on the care we could deliver, and we had MRIs and CT scans and dialysis and kidney transplants, and really everything that could possibly be used to save an animal we had. And so my responsibility in my former life as an internist was to bring together the brightest minds to focus on a single patient like this cat that has a team of doctors trying to save it. And now I work in shelter medicine, and this is a radical culture change for me because in veterinary school we didn't have any training specifically on treating groups of animals in small animal. That really was the focus of the large animal instructors, and at UC Davis we had tracking, so I didn't even take those courses. All I learned about was cats and dogs. And so now when I look at my practice, I say, who is my patient now? And certainly these unweaned orphan kittens are my patient, and the students are my trainees, but also the facility itself is my patient. I think of the shelter primarily as my patient now, and all of the other parts are the organs and bits that I need to deal with. So when we talk about how shelter medicine can help create a no-kill nation, there's actually many elements, some of which are quite obvious and some of which are new to the field and are new resources for you working in the sheltering field. Obviously, we need veterinarians to help us keep our shelter animals healthy and happy. We also need them to use their medical expertise to treat existing physical and behavioral diseases. Now we have an increase in interest in training specialists in shelter medicine. These are veterinarians who go back to school for additional years of training specifically in the field of shelter medicine. This is a brand new field. There are very few programs that are being offered in the universities now, but these are our future leaders of veterinary specialization in shelter medicine. We also advise shelters. All of the academic shelter medicine programs at the vet schools that are in existence now will be happy to take consult calls or emails. We get these every single day. We'll also go on site and provide shelter assessments, which may be very targeted or may take an entire week to complete, and we'll do an assessment of all aspects of sheltering. And I encourage you to find out what your resources are for getting these kinds of assessments, because it is remarkably helpful to get some outside eyes sometimes to come and see your operations. And then finally, we're doing the research that's needed to answer the questions that right now we don't have solutions for. And some examples might be, what is the best vaccination strategy for cats? Should we be using the new canine influenza vaccine in dogs, or is that too expensive and not valuable enough? course, all of our goals, both the sheltering professionals and the veterinarians who are working with shelters, are very similar. We want to increase the number of lives that we save, and we want to be humane in the way that we do that in terms of reducing stress and disease in shelters. So when we talk about implementing shelter medicine programs into our sheltering facilities, there's a number of opportunities that we have. It starts with recruiting, empowering, and retaining a mission-oriented veterinarian. As I said, it's not until very recently that there's been very comprehensive training programs in veterinary schools to teach the very unique issues about population medicine for dogs and cats to veterinary students. So there's a small pool of veterinarians who are really highly skilled in this and very mission-driven to join the team that we heard about today, where everybody needs to be pulling in the same direction. We need to develop strong protocols for physical and behavioral wellness. We need to make sure our staff is trained, understands why these protocols are so important, and sticks to them. We have to have the opportunity to treat existing medical and behavioral problems or recognize when those are occurring in the shelter and intervene. We also believe that the veterinarian should be in charge of population management, and this is being very aware of the statistical influences, how many animals are coming in, where are the bottlenecks, creating a flow-through that's highly efficient, as multiple people today have commented on, and getting them out of the shelter as soon as possible for their own welfare and also to avoid overusing or wasting resources in animal care days. Record keeping and disease surveillance is essential, and what we're finding in a lot of our shelter consultations is shelters don't have the records that they need to help us help them. So we would encourage you to investigate all of the computerized medical record system or shelter systems. Some are available for free, so there's really no excuse not to have one. And you'll find that if you invest some time in setting these up, you can get remarkable information back and standardized reports that can answer the questions like Dr. Scarlett had about what is the percent of upper respiratory infection in your shelter? How long does it take for cats to get that? And then that gives you a metric to compare when you've instituted an intervention to see if it's working. And then expert consultation, that's where we come in as consultants to help you out. When your local veterinarian is at their wits' end and can't seem to get past a problem, please don't hesitate to contact us or the other shelter consultants to work through the problem with you. We all know that a healthy animal is a savable animal. I like to say savable, it's not a very, doesn't flow off your tongue easily, but when we say an adoptable animal, I feel like it leaves the feral cats out of the picture, and we all know what a big component of animal sheltering and animal welfare feral cats are, and we need to understand that there are great solutions for saving feral cats that have nothing to do with adoption. And that when we talk about wellness for animals, we're talking about both their physical health, which is traditionally what everybody thinks about, but also their emotional or behavioral health. And it is an extremely stressful experience to be removed from whatever home it is, whether it's the streets or a pet home, and to be put in this environment with a lot of people and animals they don't know, with unfamiliar kinds of housing, a lot of noise, a lot of unpredictability and scary things happening. And as welfare professionals, it really is our obligation to make sure that the animals in our care are experiencing good quality of life, even if it's for a very short shelter stay. And I think you could imagine how your own pet would react if it had to go through the process that we expect a lot of our shelter animals to endure. So let's talk about the veterinarian and what they can do for your programs. Veterinarians are horrendously expensive, and so when you invest in a veterinarian and the veterinary supplies and a qualified technician to work with them, you are making a very big investment. You need to make sure that you're getting a good return on your investment, and it can be very natural to assume that the best investment return that you can get is to chain them to the spay-neuter table and not let them out very often except to use the bathroom, or to provide some routine veterinary care for animals in the shelter. But what you're really hiring in addition to that skill, we need to make time that is set aside, that is quality time for the veterinarian to oversee the wellness of the entire shelter and to develop good protocols that are appropriate for that shelter and to train staff not only their own veterinary care team, but also to be involved with training the animal care team and other parts of the sheltering system. The veterinarian is the professional in your shelter organization who is uniquely and highly skilled and trained in animal health. So the veterinarian should be entrusted to develop good health care programs. It really is not the role of management to dictate health care programs. And this is one reason why veterinarians leave shelters, is because they're being micromanaged by management. It is also important to know that none of us knows everything. This is a new field, shelter medicine, and so we all rely on our colleagues at other facilities. And so there are a number of resources that your veterinarian can leverage to increase their own skill. There is the Association of Shelter Veterinarians, which all veterinarians who are involved in this field, even if they're private practice veterinarians who are just working as volunteers or part-time in shelters, should belong to. We have an incredible listserv that is very, very active, and we share tips and questions all of the time. There's the National Spay-Neuter Response Team, which is the Humane Alliance Spay-Neuter Training Program in Asheville, North Carolina. And if you have any interest in setting up a spay-neuter program in your shelter or training up your staff, both your veterinarian and your technical staff, into efficient, high-volume, high-quality spay-neuter, this is the agency you want to connect with. They're very well funded by ASPCA and PetSmart to be a training resource, and there's just no better place to go learn how to spay in Asheville, North Carolina. It's quite a nice experience. There are the university shelter medicine programs like ours at the University of Florida, which we are happy to be a resource, and then also national shelter programs such as HSUS, ASPCA, and American Humane that offer consultation services and have a lot of written documents and protocols available as well. So there is a rich library of resources available for your shelter program. The veterinarian, as I said, does need to have authority in order to make decisions about animal welfare and animal health in the shelter. On our listserv, we frequently hear complaints about veterinarians who feel like they're not respected by management and allowed to make the decisions that they need to for the animals in their care. And it is important that we also schedule time for that veterinarian to develop protocols and train staff. Also, the veterinarian's time is extremely expensive, and so you want to make sure that they're using all of their time for things that only a veterinarian can do. You don't want them doing a lot of data entry into PetPoint about their spay-neuter program, or going to find animals to be neutered, or pushing pills to animals that need to be treated. They need to be at a higher level and delegate all of that other activity. They do need to, however, have a trained assistant. A good veterinary technician and a certified technician is ideal, because that will really expand the amount of time that veterinary care team has to devote to animals. So physical wellness. How do we keep animals healthy? We do it by having strong wellness programs, and I'll talk a little bit about these and then refer you to some other resources, because these guidelines have already been developed and you don't need to develop new ones for the most part. Strong cleaning and disinfection protocols and prevention of overcrowding and stress. So let's start with shelter wellness programs. We know that there are two ways to get animals healthy. One is to prevent disease in the first place, and another is to provide treatment. And it's almost always the case that prevention is more cost-effective and more efficient in maintaining health than waiting for animals to get sick and then trying to treat them. And we all know this if you think about the cats with upper respiratory infection. Once they get sick, it's a couple weeks out of their life and your life and that cage space, and before they're ready to be evaluated for adoption again. So if we can keep them from getting respiratory infections in the first place, we can turn over that space and save more lives. And all of our speakers today have touched on the fact that when we create bottlenecks that stop flow or stop intake or lead to crowding in our shelters, that costs an animal life somewhere. It may not be in your facility, but there's an animal out there waiting to come to your facility that didn't get in, or some other way an animal might lose its life. So our obligation is to be as efficient as possible. A diseased animal in the shelter, if it's not recognized, certainly has the potential to cause spread of disease, and there are some diseases that we can be very good at screening out, like ringworm, before they come in, and then others that are more stealthy and Florida, for example, we have a huge problem with outbreaks of distemper because animals frequently look very healthy when they come in shedding distemper, and there isn't any good point of care tests that we can screen dogs with when they come in. And ultimately, these disease outbreaks may lead to euthanasia because of illness or death in the shelter, and that reduces our life-saving capacity. So the wellness care really starts at the moment of intake, and you wouldn't want to put your veterinarian up in the intake area because that's not a good use of their time. Your trained staff can perform very good intake procedures. So what they need to be trained to do is a quick health assessment. This is not the veterinary physical exam, but they can perform a fairly robust and fairly quick health assessment to determine if an animal can go straight into holding or needs to be diverted into veterinary services for further assessment. We've heard before that we do recommend that all animals be vaccinated immediately on entry. We used to think that it took a few weeks for vaccines to work and offer protection, and it is true that they're not fully protective for a while, but we also know that that response to vaccination starts within hours of immunization. So if we can vaccinate an animal at the time of intake, it really becomes a race between exposure to disease in the shelter and that vaccine starting to work. And we do recommend, and it's very clear from lots of research, that we should be using live virus vaccines. Ideally, if you have the option, it's even better to have people bring the animals by before relinquishment, vaccinate them, and send them home for 2 weeks, and then bring them back for relinquishment. And in some shelters that do admission by appointment, that works very well. Some sort of internal and external parasite control needs to be administered at admission. The minimum would be at least some pyrantel pamoate for roundworms and hookworms, and some flea treatment if you're in an area of the country like we are that have lots of fleas. And we know that the healthy animals then can go straight into foster, which is great, or to holding, or straight through adoptions if they're ready to go, and that the diseased animals can be diverted to the vet care team for further assessment. Wellness also is going to incorporate behavioral wellness, and this has been overlooked in sheltering until very, very recently, and it is equally important. Just because the signs of behavioral illness or stress are more subtle in many cases than coughing or sneezing or diarrhea does not mean that we should shortcut on assuring that our animals have good quality of life. And we've heard today, and it's completely true, that stress is a silent killer in shelters. It wipes out the immune system, and no amount of vaccination or medication or antibiotics can overcome that. So what we see here are two different approaches to cat housing. We have the traditional steel cat units where there's very little space. Cats can't really express any of their normal behaviors. They can't even walk a few steps or stretch out full length or raise their tail to its full length. And with even modest modifications, you can create housing like this, and you can see those two kittens look so much happier. And what they've done, you can see they've drilled holes through these traditional stainless steel cages from one to the other to make little duplexes, and hung up some hammocks that the volunteers make. And now you can have a much more relaxed cat that has its food separated from its toilet and some other enrichment that will make its stay in the shelter happier. And then it's also very important that we don't lose track of animals that linger in the shelter. We consider short-term housing to be 2 weeks or less. And anything longer than that we would call long-term housing, and those animals need a special plan because their behavioral needs increase the longer they stay in the shelter. So we do have sick animals in the shelter, either at intake or that develop disease once they've been sheltered for a while. And so our veterinary care team needs to have protocols for treating animals. And some diseases are highly treatable, and we should really be aggressive about it. So here's a puppy with scabies. And with just a couple weeks of parasite medication, we can see a completely recovered puppy that would be considered healthy and an adorable new pet for someone. And then we have other more complicated diseases. We heard earlier from Texas about generalized demodex, and this is a tough disease to beat, and some adult dogs really can't beat it. It's going to be a chronic disease. But with some long-term care, many of them can resolve, and this little dog is in its new home after very extensive treatment for demodex. In fact, this dog went to foster care for its treatment because we knew it would be a long time, and like you always hope with your foster parents, they end up keeping it. So we consider foster failures to be a wonderful success. And it's so great at the veterinary school because every year we get 80 new foster homes, and they all take something. And then there's more chronic rehabilitation that shelters need to be able to perform under veterinary guidance. This is a neglected, starved dog, and we know that severely starved dogs need a special medical plan so that we don't induce a condition called refeeding syndrome, which can be fatal. And of course, this is this puppy in her new home, quite fattened up and happy. Our veterinary care team needs to have access to surgery, whether it's available in the shelter itself or provided through local veterinary clinics. It's a common sight for us to see these embedded collars in backyard dogs. And they can look very, very severe when animals first come in, but they tend to heal up very quickly from these wounds. So here's 2 days later. This dog was anesthetized. It was just shaved and clean. It's already healing within 2 days. And at that time, they did a surgery to trim out some of that scar tissue, and this dog went on to do very well. And this dog was only in our system for about a week before it was adopted. Population management is a huge subject all unto itself. This is a global look at the dynamics of animals flowing through the shelter. So when we do an analysis of a shelter's population management, we'll look at intake, what kind of animals are coming in, what the sources are. We'll look at all of their dispositions, how long it takes to get to each disposition in terms of length of stay, and the health trends on those rare shelters where we can actually gather that information from the records. And this will tell us a lot about whether a shelter is working within its capacity, because we compare these trends to the number of housing units that the shelter has, and we can look for ways where there's gaps that we might be able to fix. For instance, if animals are having a really long stay in adoptions, we can work with the shelter to find a way to move animals through adoptions faster so we can have higher turnover. As part of population management, we'd like the veterinarian to be involved with identifying the best path for each animal. So does it need to go to foster care? Is it not thriving in the shelter and it needs a break? Does it need to go up for adoption immediately, or maybe it needs a behavioral consultation or behavior training to make it a better adoption candidate? And we help shelters understand what their capacity for care is currently, and sometimes it can identify ways for them to increase that capacity. But we do need to budget our animal intake and our resources to fit within the capacity of the shelter to avoid that concept that we are concerned about called warehousing. And warehousing isn't limited to shelters that are trying to be no-kill. We go into plenty of municipal shelters that are warehousing animals with absolutely no plan for getting them out in larger numbers alive. And I think you can see this. This is an example of how a shelter responded to an analysis of their statistics. This is City of Jacksonville Animal Care and Control. And this is their live release rate for cats. For 3 years, it averaged about 7%. So if you were a cat in Jacksonville, you didn't want to end up at the shelter. It's a large shelter there. When we visited them, they took in almost 30,000 animals a year. And then Rick Ducharme and First Coast No More Homeless Pets started a program in conjunction with the municipal shelter called Feral Freedom. And basically, it's a very radical experiment in which all cats that come into the shelter in traps are immediately turned over to First Coast No More Homeless Pets for TNR. And then the No More Homeless Pets brings the animals back to their trapping site, puts signs on the door that says, this is what we do now. And so it's actually, TNR is now city policy, rather than being the exception and being a very complicated process where you have to get permission and identify caregivers. The animals are just neutered, vaccinated, and put back out. The theory underlying that is that these cats are thriving where they are. They have a home in the community, and we're starting to call them community cats now rather than feral cats. And if they're doing well, clearly they're identifying the resources that they need, whether we know of a caregiver or not. And overnight, over a few months, their live release rate went up to about 70%. Because what happened was, first it was just the feral cats, and then the staff started noticing that all the feral cats were getting out alive, but the friendly cats really weren't. So the staff at the shelter started putting their favorite cats out in traps on the loading dock. And what an irony is that, is that a feral cat gets saved, but when we were there, we said, God help you if you purr, because the outcome for cats that purred really wasn't very good at the shelter before this program. And so now it's all stray and feral cats, and if you're interested in hearing more about this, we'll have a discussion with Rick Ducharme on Friday. So disease surveillance is also very, very important. It is critical that every member of the animal care team realize their important role in disease surveillance. And probably the most important people are the kennel staff. And we recommend having a written checklist that's on the cage for every day. They can be quite small cage cards where they just check off, is there eating, drinking, diarrhea, what's their behavior? And that's something then that the veterinarian can review when they come around on daily rounds. We strongly encourage shelters to establish a system in which their veterinarian participates in daily rounds. This does take a lot of expensive veterinarian time, but it is so worth it. And the daily rounds is constructed in a way that we expect the veterinarian to lay their eyes on every single animal in the shelter, hopefully every day. That's why we call it daily rounds. It doesn't have to take a really long time because a checklist of further actions is being created. So they don't actually deal with issues that are identified right now, but they make a list and they're assigned and somebody's accountable for carrying them out. But it prevents the problem of animals being kind of lost in the system forever. And so daily rounds, we have a little form and we ask, who are you in that cage? How are you? Are you doing well? Are you where you should be in the system? Do you need something to be done for you today? And what else can we do to help you either improve your quality of life in the shelter or just move on? If you don't have a veterinarian or you don't have a veterinarian every day who can do daily rounds, you can train qualified technicians to do this, but training is the key here. It's not something just to throw to a staff member and hope that they work it out. They need to be able to recognize signs of common diseases and stress in the shelter. They need to have a veterinarian to go to when they identify these problems, because they will. And then there's a daily rounds action list of items that are identified during daily rounds that need to be delegated to somebody. And it's very important that this be a written document and that we know who it's being delegated to and that there's accountability and written record keeping of what's been done. When you've gone through all of your local resources and you're still having trouble, or you just want to take your shelter to the next level, please do reach out to one of the academic shelter medicine programs. This is our webpage, and you can certainly reach us through the webpage at the University of Florida. We offer shelter consultation and assessment services. This can be something as simple as an email with a quick question, or we do prefer email because we're never in our office, and you know how frustrating it is when you get back to the office at like 8 o'clock at night and the red light's blinking on the phone and you realize you're not done for the day. So email is usually the best way to communicate with us. This is a group of consultants from around the country. Once a year, all of the academic medicine programs get together and do a consult on one victim shelter altogether. But it does allow us to share among the different programs. We are a small specialty and we're working really hard to rise all together. We also frequently are called to help out in disease outbreak investigations because that's an emergency. We can do these focused on-site visits, or like next week we're going to spend a whole week at a shelter in Orlando. We are training shelter medicine residents. These are the specialists of the future. These are my 3 residents currently. These are veterinarians who've been all the way through vet school and they've usually worked in practice. And now they're coming back to an academic environment for 3 more years of specialized training, and then they'll be certified as a specialist. And they're trained in these topics that small animal veterinarians usually don't get much exposure to. Focusing on group health, disease outbreak control, developing protocols, and contributing to research to develop new knowledge and assisting us with these consultations. We also provide resources for your existing shelter veterinarians and shelter medicine. There's a number of conferences that are offered. Our next shelter medicine conference at the University of Florida will be October 8th and 9th. And you can go on our website and see the content. It's going to be very, very helpful. It's got hours and hours of work on keeping shelter cats healthy and happy so we can increase their adoptions, distemper, heartworm, and the new shelter medicine standards that are going to be coming out this year. And then we also, for the first time, have just gotten approved a certificate in shelter medicine for veterinary students. This is to encourage veterinary students to take elective courses in these topics, and we now offer about 10 courses in shelter medicine. And so our students that graduate with these certificates, you'll be able to identify as budding, extra committed new veterinarians that you can recruit into your shelters. All of our students participate in the clerkship. This is a clinical rotation in which our students spay and neuter dogs and cats for the local rescue groups. They also provide veterinary care every week for our local municipal shelter and go to the local homeless shelter and take care of pets for the indigent. And you'll see our students here with a puppy and a kitten. I can guarantee you that no student at the University of Florida knows that there's any controversy about pediatric neutering. They just think that's normal. So if you're looking for good spay-neuter clinics, look for Gator grads. We also have a feral cat neutering program that's part of our shelter medicine program. We, once a month, neuter about 250 feral cats. They're all trapped by community members, brought to us, and released back to those caregivers in the afternoon. This is what it looks like. Our students participate in this as well. And then finally, we are very engaged in researching the unanswered questions in shelter medicine. It was Dr. Crawford from University of Florida who discovered canine influenza virus, first in racing greyhounds and then in shelters. We've studied a lot of improving anesthetics for spay-neuter programs, studied how these TNR programs work. We're always looking at new diagnostic tests and better ways to vaccinate and prevent disease. There are actually a number of printed guidelines from experts that should be considered to be the national guidelines. These focus on vaccination, testing cats for retroviruses, and spay-neuter clinic minimum standards. And then this year, the Association of Shelter Veterinarians is going to be releasing a massive document, which will be the first shelter standards document, and they'll be suggesting minimal and optimal standards of care for animal shelters. These are going to be scary in some regards because there probably will be few shelters that can actually meet all of the guidelines, but it's going to provide a roadmap. It'll be great for anybody considering new construction because you'll be ahead of the game. And it's going to cover everything from minimum cage sizes to vaccination protocols, having written protocols. It's going to be a wonderful resource, and it's going to allow shelters to go to their funders, especially if they're municipal agencies, and say, look, we're not meeting the national standard anymore. We need some more resources. You know, good luck with that right now. I know with this economy, nobody cares, but when things do get better, these standards will help raise money to improve the welfare of animals in shelters. These are some written documents that all shelters should have. There's the new book, Infectious Disease Management in Animal Shelters. It's outstanding. Also, Maddie's Shelter Medicine Infection Control Manual is available from Maddie's Fund. That's very useful, especially for staff, because there's very nice templates for every infectious disease. And then Shelter Medicine for Veterinarians and Staff covers a variety of topics. I wouldn't buy that one right now because a new edition is on the way, so hold off. And then make sure that everybody veterinarians join the Shelter Veterinarian Association. And I would like to thank Maddie's for hosting this day today. I've been so inspired by hearing what great work shelters are doing and for making our program at the University of Florida possible. Thank you.